So sometimes when a gentleman has tried different things, tablets, injections, vacuum devices, and they're still having issues with erections, or they can't use certain things. You have gentlemen who are using nitrates for heart disease, so they can't try tablets. There is a procedure called a penile implant that can be done. And this is a procedure that's been around for over 50 years. There's a lot of patients walking around with the device and nobody knows about it because no one talks about intimacy. But the procedure itself, it's a minimally invasive procedure. It's done through a single incision. And for a majority of patients, you go home the same day. The procedure takes about 30 to 45 minutes to do. But it allows for a device that will give you an erection on demand. And everything is inside the body. So I always tell my patients, if you're at the gym and changing clothes, no one knows you have anything in. But with the device in place, it allows you to have an erection when you desire. You no longer are worrying, is the pill going to work this time? Did I take the medicine the correct way? Am I going to have a side effect from it? And the other thing is it allows for spontaneity, right? With some of our medications, we tell you you have to take it an hour before any activity. Sometimes you don't have an hour's notice, right? So you get that spontaneity back. You get back that duration. Oftentimes, a gentleman will come in and say, I took Viagra, it started working, but within 2 minutes, it stopped. And they lose their confidence. They are ashamed with their partner, and they feel like they can't perform. With the penile implant, once the device is firm, it stays firm until you decide to let it down. And so when you think about satisfaction rates, the penile implant actually has the highest satisfaction compared to tablets, compared to injections. And it's because of that spontaneity and that duration. So it's a surgery, yes, but it's minimally invasive. Like I said, 30 to 45 minutes, you go home the same day. And the device itself lasts anywhere from 10 to 15 years. So that's 15 years of not having to worry about, are the medications going to work this time? Am I going to be able to last long enough this time? That's a great option for patients.